Hello everyone, this is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about the Universal Health Voucher, and joining me on the program is Dr. Lachmie Lall and Dr. Sawan Jagnarine. Welcome to the program, Dr. Lall.
Thank you.
Today we're talking about the Universal Health Voucher, which was recently launched. I believe it's in March.
Yes.
Yes. Could you tell us about the initiative behind this voucher program? What are the aims? What are the objectives? What does the public needs to know about this voucher? And I know that this voucher is for everyone. Tell us about this.
So, His Excellency President Dr. Mohammed Irfan Ali made an announcement for a $10,000 health voucher that will include screening for non-communicable diseases. And based on that announcement, the Ministry of Health developed a program for the Universal Health Voucher, which is available to adults and children with a list of tests that are specific for the adult population and another set of tests that are specific for children. And so that is the basis of which this health voucher was developed.
The Ministry of Health has been pushing early screening and prevention so very often. Tell us, how important is early screening? I know, as we would have talked about the last program we did, many persons usually wait until a health issue would have developed, then to visit their nearest health center, then to get that checked out. So tell us the importance of early screening, because we know that is one of the things that these vouchers are definitely pushing.
Yes. So, non-communicable diseases, or what we like to call lifestyle diseases, usually they develop over time, and it's based on a number of factors: lifestyle of patients, eating habits, sedentary lifestyle, etc. And these diseases, it's important to do early screening from early ages, particularly for diabetes, for hypertension, because of the fact that some of us might have symptoms, but we're not aware of what is happening. We might have instances where your blood pressure starts to rise, but because you're not checking it, you're not aware of it until it comes to a point where it's causing other complications. And that's usually when you'll find persons going to healthcare workers when it's sometimes almost
late
too late.
stages sometimes.
Yes.
Yes, and I know that this Universal Health Voucher caters for everyone. Who can access this voucher and where can they get it from?
So the vouchers are of two types: that for children, anyone 17 years and below, and for adults from 18 years and above.
And that therefore means that babies too can...
Correct. So if you look at the back of the voucher, you will see that it is divided into different categories, starting with a specific test for neonates. Then we have for children that is less than 1 year. Then we have for those children between the ages of 1 to 5, and then from age 6 all the way to year 17 for children. And for adults, it's from age 18 and up, both male and female.
Wonderful, everyone included. For persons who are watching the program or might be listening and wondering, where can I pick up this voucher?
So the vouchers can be picked up from any health facility, any health center, any hospital. And additionally, vouchers are given to line ministries, to organizations based on specific requests coming to the Ministry of Health. So these are some of the places where vouchers are available. Additionally, there are going to be outreaches. Outreaches are currently happening in all of the regions, and you can also uplift your voucher there. Once you have your voucher, on the back of the voucher, there's a QR code. All you have to do is simply scan that with your phone, and it will show you a list of providers where that voucher can be utilized.
Thank you, Dr. Lall. We're going to go into a short break and be right back with more information on the Universal Health Voucher.
Guyana is taking a bold step towards a healthier future. Introducing the Universal Health Voucher valued at $10,000, available to every citizen. This initiative by the government of Guyana gives you the opportunity to access early screening tests for non-communicable diseases like diabetes, hypertension, and cardiovascular conditions, with NCDs accounting for approximately 68% of all deaths in Guyana. Early detection is important. This program represents a $5 billion investment in the health and well-being of our nation, benefiting 500 people across the country. Eligible individuals include children from birth and adults 18 years and above. At the back of the voucher, you'll find a comprehensive list of tests available to you. To locate facilities where you can access these services, simply scan the QR code provided. This will direct you to a list of accredited healthcare providers. Don't hesitate. Visit your nearest health center to uplift your voucher and take charge of your health today.
To get started, open your phone's camera app. Most smartphones support QR code scanning automatically. If your phone doesn't detect the code, simply download a free QR code scanner from the Google Play Store or App Store. Hold your phone steady and make sure the QR code is clearly visible in the camera frame. Your phone should recognize it instantly. Once scanned, a pop-up notification will appear with a link. Simply tap the link to open it in your browser. You will now see a list of service providers that accept the voucher. Browse through the locations to find one that's convenient for you. To keep the information handy, take a screenshot or bookmark the page. You can also share the link with friends or family who may need it.
Hi, I'm Dr. Danelli Dripal, the coordinator for the Chronic Disease Unit. I'm sure you're wondering how you could uplift your universal healthcare voucher. It's quite an easy step. All you have to do is present a valid form of identification. It can either be your government issue ID, your passport, driver's license, or even a birth certificate. It's simple as that. Hi, good morning, Miss Lisa. I'm here to collect an adult voucher. The universal healthcare voucher. Thank you very much. And also I have a son, he's 15 years old. I'd like to uplift a voucher for him. Okay, thank you very much. And for the children, you may know that you can uplift that without an identification. All we need is for the parent or the legal guardian to present their ID. So as you can see, the process is quite simple. You just go to your nearest health center and you can receive a voucher today.
The thought of developing cervical cancer may seem scary, but the good news is that it is preventable and treatable. The key is vaccination and being screened early. Cervical cancer is the second most common cancer in women in Guyana. It is caused by the human papillomavirus, commonly known as HPV. Almost all sexually active people will be infected with HPV at some point in their lives. Therefore, it is important that women aged 21 years or older get screened for cervical cancer. Prioritizing regular pap smears, VIA screenings, or getting an HPV test done is crucial. These tests will aid in detecting precancerous lesions, making it easy to catch cancer in its early stages. These screenings are quick, easy, and free of cost. They are available at various public health facilities in your region. Remember to spread the word and encourage your female friends, mothers, sisters, and daughters to prioritize their health. Early detection is key to successful treatment and a long, healthy life. Together, we can prevent cervical cancer. A message from the Ministry of Health.
Welcome back to the program. For those persons who've just tuned in, we're talking today about the Ministry of Health's Universal Health Voucher. And joining me today is Dr. Lall. Dr. Lall, could you tell us about some of the tests that are available for both children and adults?
Okay, so like we touched on before, for the children's voucher is divided into age categories. So some of the tests that you will see at the back of the voucher includes a complete CBC, for tests for thyroid function. For the neonates and the less than 1, you will see an hemoglobin electrophoresis being one of the options. Additionally, we are also doing kidney functions for those children that are older, and an HbA1c is available for children as well.
Okay, and this voucher is for one person, it's one per person
Yes,
for this year.
every child and every adult is entitled to one voucher.
Dr. Lall, tell us, for persons who may think that, okay, I can go with this voucher, once this is done, I can come back with another one. Tell us, what system is in place to ensure that that does not happen?
Okay, so that will not be possible because there is a database that is given to providers so that as they start to enter your information and match it back to a voucher, we will see if you had access to a voucher before. And as such, if you have a second one, you will not be eligible to use that voucher.
Okay, for persons who haven't yet accessed these vouchers or who are now hearing about it, why should they even go pick this up? Tell us again. Why should they use this voucher to their advantage? I know this voucher is valued at $10,000, and at the back of that voucher, they have a variety of tests they can choose from to do, and this is at a subsidized cost. Tell them about this.
Okay, so like we said before, it's screening for non-communicable diseases. So why you need to get this voucher is because you want to participate in early screening.
Yes.
You want to see what your blood sugar levels are. You want to see what your cholesterol levels are. You want to see what your kidney functions look like. And so that's why it's important. That's why we're pushing the population to do early screening. Apart from that, this program will allow us to see the incidences of diseases as they appear in our population. And that in turn helps us to make policy decisions, help us to forecast for medications among a number of other health programs that can be developed from the data that we will get from this voucher program.
Awesome. Thank you so much, Dr. Lall. And I know that this voucher also caters for men as well. And so we're going to talk about prostate cancer in just a bit with Dr. Sawan Jagnarine.
Did you know that 1 in 8 men will receive a prostate cancer diagnosis in their lifetime? While not always life-threatening, early detection is essential to treat prostate cancer successfully. You must visit a doctor to determine if you have prostate cancer, as it does not show symptoms in its early stages. Age, family history, and ethnicity can increase your risk of developing this type of cancer. Late-stage prostate cancer can cause difficulty urinating, weakened urine stream, blood in urine or semen, bone discomfort, weight loss, and erectile dysfunction. Talk to your doctor at the nearest health center to learn more about this disease and your risk factors. They can assess and suggest further screening if needed. Remember, early detection can make all the difference. Don't let this disease catch you off guard. Take control of your health today. A message from the Ministry of Health.
Greetings everyone, I'm Dr. Lachmie, Lall, Director for NCDs and Mental Health here at the Ministry of Health. All vouchers are available at all health facilities across the country. All of your health centers, regional hospitals, health posts, health huts. So you can go to any of those facilities, you walk with any form of identification, whether it's your ID card or a passport or a driver's license, so that you can uplift your vouchers. Additionally, if you are not a patient of the health center, but you are a patient of the area that the health center services, you can also uplift your voucher from that very health center. Once you uplift your voucher, there is a QR code at the back of your voucher, which you can quickly scan with your phone. That will give you a list of providers where you can take your voucher to have your test done. Once you uplift your results from the lab, you can take that result back to your nearest health center for a doctor to interpret that result. Or you may wish to continue your service with the private lab, but that would be at the cost of the patient.
Today, I'm here to talk to you about the Universal Health Voucher, which was launched recently by the Ministry of Health. As you guys know, we have one for the adults and one for kids. As you collect your vouchers, you can also ask your facilities or the persons there for some help. Now, with the Universal Health Voucher for the adults, we have some tests at the back, which you can be able to see. These tests are very important. They usually can be able to help us to diagnose some of the chronic diseases that we have or know, such as diabetes and hypertension. So we're urging all of our adult population to be able to collect these vouchers. You are entitled to one voucher per person. Now, for the children voucher, we also have for our kids, and when I say kids, I mean from the baby ages, from 7 days old to 17 years old, we can be able to use our children voucher. As for the adults, at the back they are listed the tests that you can be able to do. Now, these blood tests, they range from a hemoglobin electrophoresis. You guys might say, oh, that's a really big blood test name, you can't remember it, but tests like these are able to detect if your child has sickle cell or not, among others such as cholesterol, thyroid function, and even kidney diseases. So guys, please, if you have kids, make sure that you get your children voucher. Now, if you want more information, the Ministry of Health has developed a brochure for both adults and children. This is the adult brochure where you can be able to read and know what tests you would like to do, what the tests entail, and you can be able to pick these up with your vouchers at any of our locations.
Welcome to our website. We're here to provide you with reliable health information, services, and updates. At the Ministry of Health, our mission is to protect the health of every citizen in Guyana. We are committed to offering accessible, high-quality healthcare, helping individuals and communities to lead healthier lives. On this platform, you can find a variety of resources to support your health journey. Check out our programs that cover different health needs, from preventative care to managing chronic diseases. Stay updated on our latest initiatives and policies aimed at improving public health across the nation. We'll keep you informed about the important public health updates, including alerts, vaccination campaigns, and community health events that promote awareness and education. Thank you for visiting, and we look forward to your continued connection with us in our shared goal of a healthier future for everyone in Guyana.
Welcome to the program, Dr. Jagnarine.
Thank you for having me.
So, as we talk about the Universal Health Voucher, we know that there's a test there for men as well, which is the PSA test. Tell us about that and why should men access this service?
That's very good. And first of all, we must commend the initiative, the Universal Healthcare Voucher.
Yes.
Since it actually covers a wide spectrum of areas of chronic diseases. And for men, the PSA screening. So PSA screening, what we looked at is PSA, which is prostate-specific antigen, is actually secreted from the prostate gland. And when somebody develops prostate cancer, you find that cells in the prostate has grown out of proportion and they start to function abnormal. And what happens is that you will tend to have an increase in PSA secretion. Now, during this whole scenario, the function of the prostate gland is actually to help to give nutrition to our sperms as they make their way to as we have fertilization in the process. So what happens is that when you have abnormal cells and you have cells that are growing out of proportion, and you have an increased PSA, this is actually an early indication. And it's an excellent screening tool for persons who want to screen for prostate cancer. Because over the years, there have been a stigma on prostate cancer and screening for prostate cancer because of the digital rectal examination. Men think that you're violating them, and you're discriminating against them, and you had that huge resistance of actually visiting the healthcare provider. But what we have found over the last 3 years is that 19% of cancers is actually related to prostate cancer, and it's actually the leading cause of cancer death among our men population. So we have done a detailed check, and we have seen that 1 in 5 men who actually screened, they had a positive indication of having prostate cancer. So what we have decided is that we advocate that we want our men within their specific age group, like we want men who are 45 years and older. We want them to ensure that they make that mandate
Yes.
of having their PSA in their screening profile or their periodic health assessment that they do on a yearly basis. Now, persons who have a family history of prostate cancer, we want them to screen earlier. They start screening at 40 because they are considered to be the high risk group. Now, having said that, one of the key things, Alicia, that we want people to know is that the early stages of prostate cancer, you're being asymptomatic. You don't have any signs
No
or
signs,
symptoms,
symptoms.
right? And within the men's health unit, we have been screening men across the country, and sometimes some of the men who were reluctant to actually go ahead and do a biopsy, um, you know, they said, doc, we're not symptomatic, but then their PSA came back elevated.
Wow.
And when we actually do that biopsy, and when we now you have quick turnover time at Georgia Public Hospital Clinical Pathology Lab, so we are able to get their results very fast, and we let them know what is happening. You find that gentleman, eager, with full strength, ready to go get himself, into the oncology clinic, get himself ready to be tested further, because it's at the initiation phase of that cancer, and we can be able to treat it very quickly. And as the old saying goes, early detection saves
Save
lives.
lives.
So this could be one of our fathers, our brothers, our grandfathers, and this we have to capitalize on,
Definitely.
right? So that is why the advocacy and the promotion within the universal healthcare voucher, this will be an asset to our men population.
Indeed. And because so many men are reluctant to go in and get this test done, what can they expect whenever they go to get a PSA done?
That's a good question, because most times when you talk about prostate cancer screening or prostate screening, the stigma and the violations
Yes.
statement comes up. But this is a simple blood test. A simple blood test. You go when you're doing your other tests. You're just getting bored once for everything, and it can be done.
Wow.
Right? And then when your results comes back, you're able to be able to look at your results. If your results is more than 4, you want to actually visit your urologist and be able to be advised further, right?
Definitely. How can the women population support men in getting this test done?
Beautiful. Since we have started this program, the women is actually, especially in the antenatal unit,
Yes.
they have actually been propelling this conversation because they want the male population to also go and get themselves screened. So we can actually do this as a couple screening,
Definitely.
right? So we can do it together as partners, complement the family approach. So with all the necessary screening, and complementing that family approach, we can go out there and do this for us. We can start this year and continuously do it every year, right? Which will capitalize on our health and well-being, because when we do this screening and we know that everything is okay, mentally we are fit. Positivity flows around us. So our physical well-being, our mental well-being is actually taken care of. Now that's an asset to an individual, because the functionality of that individual towards society is better.
Indeed, and it benefits the society, definitely. For men who are thinking, okay, I have some questions about my health as a man, where can they go to get men's health information or education? Is there any clinic available?
So when it comes to men's health information, all centers, all health centers, has an individual there, whether it's a doctor or a nurse, that is educated, has the knowledge, that is capable of sharing that information at any time that you go there if you want to have information on men's health and prostate cancer screening today in Guyana.
Awesome. Dr. Jagnarine, before we wrap up today's program, do you have any last words for the men who are listening and viewing this program? Any word of encouragement?
So one of the things that I want to emphasize, and one of the things that we have actually found, is that when yes we go and screen for your voucher, we also encourage men to also screen for do their HbA1c, their glycosylated hemoglobin,
Yes.
because we want them to rule out that they don't have diabetes, because diabetes is one of the key factors that affects a lot of issues in men, right? Especially erectile dysfunction. So we want them to actually make that a priority when they go and do their screening. So we're looking at other issues that affect the men. So men's health is not just prostate cancer. Men's health is from
It's
head to
more than
toe.
that, yes.
So we have to expand, and gradually we will get there. So with that, I just want to encourage our men to make full use of the universal healthcare voucher and go out there and support this good cause.
Thank you so much, Dr. Jagnarine, for joining me in the program today. And I encourage you to keep up the good work that you've been doing at the Men's Health Unit.
Thank you.
Thank you for staying tuned with us. Do remember to pick up your Universal Health Voucher at your nearest health center. I'm Alicia Martin saying goodbye for now.